Good morning, everybody, and sorry to have so big space and delay between videos, but there are some features present or coming that I'd like to inform you about to avoid any confusion, frustration. At the moment, I'm working on version 9.3.0.3214. The first thing I'd like to show you is CDM deregistering option. Now, as I mentioned in email group, the documentation of the reason is not done automatically, so you want to pay attention to what you're doing. So you might decide to go through your overdue visits that are very, very long, because probably that's where you will find your nursing home patients or patients who died since review. So if I go to my chronic disease management dashboard, to my last visits, I changed those to overdue. I removed the time filter, and then I will see all the overdue patients. If I click on due date, it will sort them, giving me the eldest here, right? So those are the patients, 2022, 23, that probably need review. I have one of those kind of pre-prepared here, and you have kind of obvious reason of why they are not attending, they died. So to deregister them, you go to HCR and you have CDM deregistration. Opening this field would attract a window to explain why you're deregistering. Click OK. That's done, right? So if I refresh here, I believe that was the second patient on the list. This patient has been removed from the list, right? In terms of documentation of deregistration, it's quite subtle at the moment. So if you look at this blue icon on the side, it looks a bit differently. And by differently, I mean the usual blue icon is circle with a horizontal line, whereas this deregister, this line is kind of broken, it looks down, you see? So this first one is about registration with chronic disease, heart disease, and then second one is atrial fibrillation. So both of them are broken. The benefit of that is that you do not lose any clinical information. All your CDM visits that had happened are still present, right? So I have all historical data. I just do not have this patient on dashboard. As you noticed, there's no new transaction here at all. Probably not so important for a patient who died, more so for a patient who, let's say, withdrawn their consent or they move to nursing home. You might, if they then get out of the nursing home, you want to know when you registered and why. So you might decide to create a new transaction called planning and just include information that the patient was deregistered, right? So that's the first thing I wanted to show you, deregistering. Now, the second new feature is called CDM Finder. The HSE had requested for this function to be included. It is not, in my opinion, working well enough to be in prime time, so use it knowing that it's not ideal and it's under current development. However, there is a plan to start releasing this to some alpha sites, so eventually it will reach all of you. Most importantly at the moment, the name of the finders that were requested do not correlate with the CDM conditions. To be more concrete, there is heart failure finder that includes essentially ischemic heart disease and heart failure. And there's atherosclerosis finder, including potential patients with peripheral artery disease, although it is not part of any CDM program. And some drug searches are also going to be creating a lot of false positive of what's called a possible or probable case, as any patient on ACE inhibitor or ARB would be flagged as potential heart failure patient. So you'll have all your hypertensives there as false positive. And also all patients with any topical steroid prescription will be found as the potential asthma COPD case. So in terms of where this will be, if you click analysis, under chronic disease management dashboard, you have a new icon, chronic disease finders. I can't show it to you live because the anonymization tool does not work there. I'll show you some screenshots. So on the screenshot you will see that there is category of definite, so that should really work for certain keywords or ICD codes within their history. At the moment, however, you will see that it also looks at family history that will be corrected, and it doesn't recognize that ischemic heart disease equals IHD. So this patient should not be listed because they are registered with the program. Had said that, because in case of this particular finder, what they wanted to call those patients as definite case of heart failure, and they're not coded as heart failure. By their logic, it's correct, although clinically it's in a way useless at the moment. It is much better for AFib. As you can see, it did identify few GMS patients, so I will have to investigate them in my own practice case, why they are not registered with CDM, although it looks like they are coded as having atrial fibrillation. Is it just recent diagnosis? Did we not get them in yet? You will get also all private patients. That was again a requirement of HSE. They wanted to have all patients in. However, this patient type filter here, if you decide to just look after your GMS patients in terms of income and structure of CDM as such, you can use that. If you have created in your own practice private patient arrangements to avail of similar care as GMS patients avail of with the CDM, you might just filter those private patients. So we covered CDM finder. Please be aware that, as I said, it is not ideal yet. That's the most of the time that's spent currently on development on the finder, and it will be getting better, but please bear in mind it's not perfect yet. Moving on to another thing. When you get a new patient now from different practice, if you want to register them with CDM, what happens is the Health One calls out to PCRS, as you can see here, and you have information if this patient is registered with anything at the moment, right? Are they with any program or not? The PCRS information, it only knows about admin things really. So what kind of program, what was the date of review, how many diseases patient is registered with. They have no clinical data as it goes in separate anonymized message to the HSE. So you will not get clinical data fed in, but you will get empty admin fields within your timeline transactions to mark and show when the patient was seen. And that will help you decide when is the next time they can be seen within the cycle. That, however, brought a second order consequence, and namely, because the Health One has to call out to the PCRS, it has to have a certificate for PCRS, and also the password has to be in date. So if your password is out of date, and as you know, the PCRS password will expire every 3 months and you're forced to change it, this is the error you will receive. The problem with that is that currently a nurse is unable to update the password. So if I clicked on the link, the blue button that appeared on the error message, right? Check PCS credentials, that's what I'll see. But because I was logged in as a nurse, it did not allow me to change it. So I have to close Health One, open it again, put a new password, close it, open again, allow the nurse to log in. Another thing that was improved, and probably noticed it in background already, if I send an email out and I add attachment to it, the list of attachments will be also documented in the transaction. So you will see to whom it was sent, from whom it was sent, timestamp, and also other documents that were attached. So you have much better log of what was sent to whom, when. And since we spoke about emails, you probably all heard about two-factor authentication introduced by Health Mail. That will be done in a phased way. I got already my kind of notice and I was enrolled, even though I tried last year, but now it had been enforced. So what that means is that once a day, once in 24 hours, if I try to log in to my own Health Mail, it will prompt me to give second factor authentication. So as you can see on the example here, because that's incognito mode browser, it does not recognize that this was already checked on this system what is my second factor. Now they mention, I know they mention specifically the Microsoft Authenticator. That is my preferred tool, open source password, one-time password generator. The algorithm is public, so there's no secret sauce in it. That's what I'm using. What I would suggest, and especially for practice accounts, when you are generating the QR code for the two-factor, make a screenshot, print it, keep it within your safe together with your opioids, because if you lose your authenticator, that's the easy way to set up a new one. Once you have a screenshot of this QR code, you essentially have hard copy, old-fashioned backup of it. So to set your two-factor authentication on, once you logged into your Health Mail, you click on the right top corner on your user, you click View Account. Within the View Account, you go to Security Info, Update Info. And this is where you can set up your time-based one-time password. Karina Hull, who is running Health Mail, said that practice emails will be postponed until next year in terms of rollout of two-factor. And they're hoping to deliver a single method of hopefully certificate authentication that will cover both Health Mail and PCRS. That's end of this recording. I hope you found it helpful. See you around.